palpitations, pounding heart or accelerated heart rate, sweating, trembling and shaking, feelings of choking, nausea, and abdominal stress are all symptoms of anxiety. Anxiety disorders are the most common mental illness in the United States, affecting 40 million adults in the United States 18 and older a year. That accounts for 18.1% of the United States population. Very few people feel like they should get help for their anxiety disorders. Reported only 36.9% of those suffering from anxiety disorders receive treatment. I myself suffer from anxiety disorders. I have spent time in a mental institution due to anxiety and depression that I've been diagnosed with. I myself have gone to many different doctors and gotten second opinions several times, and they have all said that I have anxiety and depression. It is not uncommon for someone with anxiety disorder to also suffer from depression, just like I do. Nearly one half of the people in the United States diagnosed with depression are also diagnosed with anxiety disorder. General anxiety disorder affects 6.8 million adults, or 3.1 of the United States population, but only 43.2 of that figure receive treatment. Women are twice as likely to be affected as men, and general anxiety disorder often occurs with several other mental illnesses, including depression and panic disorder. Social anxiety disorder is also very common, affecting 15 million adults, or 6.8% of the United States population. Social anxiety disorder is equally common among men and women and typically begins around the age of 13, according to a 2007 Anxiety and Depression Association of America survey. 36% of people with social and anxiety disorder report experiencing symptoms for 10 or more years before seeking help. Obsessive compulsive disorder affects 2.2 million adults, which is 1% of the United States population. OCD is equally common among men and women, and many that suffer from OCD also suffer from anxiety, and several doctors say that OCD and anxiety are closely related. The average age of onset is 19, with 25% of cases occurring by the age of 14. 1/3 of affected adults first experience symptoms in childhood for OCD. Post-traumatic stress disorder is also a branch of anxiety disorder. PTSD affects 7.7 million adults, which is 3.5% of the United States population. Women are more likely to be affected than men. Rape is the most likely trigger for PTSD. 65% of men and 45.9% of women who are raped will develop the disorder. Childhood sexual abuse is a strong predictor of lifetime likelihood for developing PTSD. Major depressive disorder has a big problem in the United States as well. The leading cases of the disability in the United States are from ages 15 to 44. Depression affects more than 16.1 million American adults, or about 6.7% of the United States population, ages 18 and older in a given year. While major depressive disorder can develop at any age, the median age onset is 32 and a half years old. It is more prevalent in women than men. Anxiety does affect a lot of people, and it's very bad, and there's a lot being done to spread awareness for anxiety to help combat all the people that do not go and receive help for it. There's no reason not to receive treatment, and a lot of people feel weak for having to get help for a mental illness like anxiety. However, it is very, very common in the United States, accounting for 18% of the population. Some people experience what is referred to as limited symptom panic attacks, which are similar to full-blown panic attacks, but consist of fewer than 4 symptoms. Although anxiety is often accompanied by physical symptoms such as a racing heart or knots in your stomach, what differentiates a panic attack from other anxiety symptoms is the intensity in 10 minutes or less, and then begin to subside. Due to the intensity of the symptoms and their tendency to mimic those of heart disease, thyroid problems, breathing disorders, and other illnesses, people with panic disorder often make many visits to emergency rooms or doctor's office convinced that they have a life-threatening issue. Panic attacks can occur unexpectedly during a calm state or in a state of anxiety. Although panic attacks are a defining characteristic of panic disorder, it is not uncommon for individuals to experience panic attacks in the context of other physiological disorders. For example, someone with social anxiety disorder might have a panic attack before giving a talk at a conference